Hi, I'm Jack Zoumaras and welcome to my video blogs. Today I'm just going to outline the various facelift techniques that are available today. As mentioned, when I was on fellowship in New York City and also North America and Paris and Europe, I learned a lot of different facelift techniques from a lot of different surgeries, and I offer most of those facelift techniques to my patients here in Sydney and in Australia. You may have heard the term conventional facelift. What a conventional facelift is a facelift incision that's in front of the ear, behind the ear and in the hairline. And that's what most plastic surgeons use to access the face. What you do to the face after that also differs. So you can do what's called a smastectomy, where you're removing layer 3, so the muscle layer of the face, and that helps tighten the face. And that's probably the most common operation done, invented by Daniel Baker, who I trained with in New York. You can also just suture the smash. So for example, instead of cutting the layer 3 out and suturing it together, you can just oversew it in what's called a plication. And that's also one of the most popular techniques, and probably the most popularly done facelift by all plastic surgeons. And the reason what makes you pick whether you're going to do a smastectomy or a plication depends on the patient's face. So if a patient has a very fatty face, you would cut the smash out, because you don't need to have that excess smash, especially as you're lifting it up, as you're lifting this part up. If a patient has a very drawn out face or they haven't got a lot of volume, that's when you do a plication. So you'd keep the smash and actually layer it on itself to give you high arched cheekbones. So you may have also heard the term short scar facelift. So what a short scar facelift is, a facelift just in front of the ear, and because it's just in front of the ear, you can only do a plication or a smastectomy. Now the other facelifts that you do is, again, depending on what you do to the face. So they're called various smash flaps. So you can do a conventional smash flap where you're actually raising layer 3, you're lifting it up and reconstructing it. Or it can be an extended smash flap where you're actually making the smash go further towards the midline, towards under the eye. Or what I like doing, and what I learned from Tim Martin, is a high smash where you actually start quite high up, almost at the eye level or at the eye level, and that gives you a mid facelift that improves the eye. This is a very powerful technique. So there's the actual incision you make with the face, so whether it's short scar or conventional, and then what you do to the smash. So what you do to the smash, you can either do a high smash flap, you can do a conventional smash flap or an extended flap, or you can do a smastectomy or smash plication. And that's essentially the facelift menu that you have on offer. And different techniques are often more appropriate for a certain patient. Any patient can have the high smash because it's a significant reconstruction of the face, almost like renovating your kitchen. Whereas the shorter operations, or the short scar facelift and smastectomy, are more suitable to the younger patient that hasn't got a lot of aging deformity. The high smash flap will last longer compared to the other operations, but that's the actual menu of facelift. So to summarize, you can have a short scar or a conventional scar facelift, and the scars work out really well and then you barely see them, and then you can either lift the smash up as a flap, and that's the preferred technique, or you can actually suspend the flap either with a smastectomy or a smash plication. And with each of these procedures, except for the short scar, you can add a neck lift as well. And that's essentially the range of facelift techniques that you can have, and I'll explain these in more detail individually.